Hi, my name is Krista Arvizo, and this is going to be my presentation on SIADH for my Adult Health 3, Module 3. So what is SIADH? Well, let me tell you. SIADH is Syndrome of Inappropriate Antidiuretic Hormone Secretion. So it is an excessive amount of antidiuretic hormone, ADH, that is released from the posterior pituitary gland, resulting in water retention. And this results in a low sodium level. So when there's a low sodium level, the blood will be diluted and the posterior pituitary gland will still release ADH, even though it should not. So since this is happening, all the extra ADH inappropriately is causing the kidneys to reabsorb more water, causing low blood sodium level. So when there's a low blood sodium level and a low plasma osmolality, combined with a high osmolarity and a high urine sodium level, this is a red flag for SIADH. So what are some clinical manifestations? So clinical manifestations for low sodium levels is going to be dehydration. So what are some common side effects with dehydration? You'll have low urine output. This is concentrated urine due to the suppresses the secretion of ADH. You could also have fluid volume excess. This is extra fluid being reabsorbed into the body. A patient may also have mild hyponatremia. This causes muscles cramping and irritability. So when a patient has SIADH and they have these symptoms of dehydration due to the low sodium levels, this is a low sodium level. So it means it's below 120. So what causes the enhance that release the effect of ADH? Mood stabilizers. So medications can cause SIADH. So a mood stabilizer or an anti-epileptic can change the way that ADH is released into the body. So when this happens, so say a patient is getting carbazepine, this acts in part of increasing the sensitivity to ADH. Another medication is like a central nervous system disturbance medication. This can enhance ADH release from the pituitary gland that can lead to SIADH. Specifically to the pituitary gland also might cause extra ADH to be released. Did you know malignancies can cause SIADH? Malignancies. Small cell carcinoma is the most common tumor leading to ectopic ADH production. Less commonly, extrapulmonary small cell carcinoma, head and neck cancers also cause ectopic ADH release. Some complications with SIADH is the symptoms a person may express is those that are dealing with like dehydration, because both are a low sodium level. So when a person's body has a lower sodium concentration than normal, you can experience symptoms similar to dehydration. So some of these symptoms are nausea, vomiting, headaches, seizures, coma, and even death. But there are interventions. There are things we can do. So we can monitor these patients' weight because they're retaining fluid, which means they're gaining weight. So we need to monitor them. We need to monitor their intake and output. We need to see how much fluid they're putting into their body, how much fluid they're getting out of their body. We need to observe for signs of hyponatremia, including seizures, headaches, vomiting, and decreased neurological functions. These patients are going to be on daily weights due to the fluid retention. You're going to want to turn these patients frequently and do range of motion exercises. You're going to want to monitor their potassium and their magnesium levels to make sure if too much electrolytes are being released from the body that we are replacing those losses. You're going to want to monitor different medications that these patients may be on, because some medications can cause SIADH, such as a loop diuretic. What is a loop diuretic? Lasix, also known as furosemide. This medication is given about twice daily, and it promotes diuresis. So that means we're diuresing the body, which means we're pulling fluid. And when we pull fluid, we pull electrolytes, such as sodium. So when we pull that sodium, it's a sodium loss, which can end up in SIADH. So you're going to want to monitor these patients, especially if they're on like demeclizine, which is an antibiotic that decreases renal tubal responsiveness to ADH. You're going to want to monitor these patients. You're going to want to see what kind of signs and symptoms they are experiencing. Some patients, as the sodium concentration continues to get lower in the blood, the neutrons of the brain begin to swell. This can lead to cerebral edema. And when this is caused, a patient may experience hallucinations, seizures, coma, and even death. I want to thank you for listening to my TED Talk on SIADH, Syndrome of Inappropriate Antidiuretic Hormone Syndrome. I hope you learned something. Thank you.